Good morning, everybody. Overnight, we had 5,400 tests with 11 new cases. Out of those cases, one has an unknown source. All the others have a known source, and Dr. Kerry Chant will provide that update in her report. There's a couple of things I wanted to stress this morning. Firstly, it's really important for as many people as possible to come forward and get tested. We want to see that number average out to at least 8,000 a day. If you have the slightest sniffle, if you have a scratchy throat, if you work with vulnerable people anywhere in the state, please come forward and get tested. It's really important for us to manage the spread, to control the spread, and we can't do that if enough people don't come forward and get tested. So please make sure you do. We're making it as easy as possible, and if you want any information, you can look up our website, you can call 13 77 88 24/7, or you can ring your local GP or local health facility and get the best updated information. That is so important. I also wanted to make a comment about some of the changes to restrictions that I spoke about yesterday. Please know this does not give you a licence to go beyond the rules. Please know how important it is for everybody to respect the rules we've put in place. The reasons why we're allowing people to come into other people's households is to extend the definition of care. It's to reduce social isolation and it's to improve mental health, because we know that so many people in our community have been literally locked up in their homes for weeks on end. We thank them for it. However, we expect every family, every close friendship to have a conversation about what you do with the new arrangements. In my case, I'll be still standing outside the house and not going into my parents' home when I visit them, because I'm still in contact with a lot of people and I don't want to put my parents at risk, which is why I won't be going into their home. And these are conversations every family should be having. If you're visiting someone in particular who's vulnerable, who is a particular age or has a comorbidity, please know how virulent, how contagious this disease is and the horrible impact it can have if you get the serious side effects from it. We don't want to see families unnecessarily go through that grief. So please have those conversations with your families, have conversations about what you can do. And we haven't put a limit on how far you can travel in order to visit a loved one, but we ask everybody to be responsible. This is not a holiday. The reason we're allowing people to do this is to reduce isolation, to improve mental health, and to give people that bit of contact, which they haven't had for some people if you're working from home for a very long time. So the 4 reasons why you should or can leave the house still remain. It's whether you're working or going to school, it's whether you need to buy something, whether it's for exercise or whether it's for care and medical needs. And the fact that you can visit another person's household is an extension of the definition of care. And I want to make that point very specifically, because I don't ever want to be in a situation where New South Wales has to go backwards on something we've allowed people to do. If everybody sticks to the rules and moves forward together, we won't have to go backwards in terms of the restrictions. I want us to keep making steps forward, and we can only do that if everybody cooperates and everybody respects the rules and has their conversations with their loved ones, conversations you should have before you undertake a visit. Will there be physical contact? How long will the visit be, and what risks are associated with everybody when they make that change? And it's really important to have that conversation. And I wanted to specifically also comment on Newmarch House, that Anglicare aged care home. The number of deaths yesterday was devastating, but I think what it does is remind us how contagious this virus is and how it attacks the elderly and vulnerable in particular. And our hearts go out to all the families of the people who've succumbed to the disease, but also to all the families who are really worried about their loved ones. And I can confirm that last night the Minister for Health contacted the Federal Minister for Aged Care to express our government's concerns at the lack of communication between the centre's operators and the relatives. I can't imagine how distressful that is. Many of us have had a loved one in an aged care home or do have one now, and it would be devastating not to be able to contact them, not to be able to be with them during this distressing time. And we've made our concerns known to the Federal Minister. And of course, New South Wales Health is doing their part in supporting the federal government's efforts in relation to that home. I also wanted to stress that we are preparing in every way possible for schools going back. I'm very pleased to have with me today the outstanding Minister for Transport, Andrew Constance. Our message today is about cleanliness and cleaning. So you may recall that recently we announced $250 million extra for cleaning, $250 million. A large proportion of that will go to the transport system to make sure that people who need to use the transport system can be confident that there's that deep level of cleaning. A proportion of that will go to schools, and a proportion of that will go to other public institutions where we know that people will be moving around. And so far we've employed an extra 500 cleaners across the state as part of that $250 million package, and by August we anticipate that number will go up to 3,000 extra cleaners that we've employed to make sure that as the level of activity increases in May because of schools going back, that we're well and truly prepared in every aspect. And also from May 11 we'll have a better sense of how many people, how many children, how many adults are likely to use the public transport system with the advent of schools going back. So this is part of the reason why we have that staged approach, to make sure we prepare, to make sure every aspect of school going back is as safe as possible, and mainly in and around the adults who will be supporting the children when they go back to school. Again, can I thank New South Wales for your efforts? Can I appreciate the sacrifices everybody has made, which is why the New South Wales government has moved to ease some of the restrictions from Friday and going into May. But I also do it with caution. We don't want to go back to a situation where people are having to be literally isolated in their homes. We have allowed for the relaxation of this restriction based on the definition or the extension of the definition of care, and that's really important. It doesn't mean we can all just relax and do what we like. Quite the opposite. We have to stay vigilant, because we've seen around the world countries they think they're over it, they get complacent, and then thousands of people die as a result in a very short period of time. We don't want to see that happen in New South Wales. We don't want to see us go backwards. We want all the hard work that we've done so far to pay off. We want all the hard work to be meaningful moving forward. And I just ask everybody to please take on board the relaxation of the restrictions that come in place from Friday, but do so with caution, do so with having the conversations with your loved ones, because certainly I don't want to be in a position where we have to go backwards. But that is a risk if too many people don't do the right thing. I'll now ask Dr. Chant to give her updated medical report. Then I'll ask Minister Constance to talk about the public transport and cleaning in particular, and then we'll be happy to take any of your questions. Thank you.